Why is this here? What happened to you?
These healthcare aides have come together to speak out about work conditions at Holy Family Home. Melda Macalino says she's on disability leave because her job at the long-term care home grew unbearable.
We're doing our best, and like 20 people taking care of them.
Macalino has been an aide at the 317-bed facility for 24 years. She and the others say aides on the evening and night shifts care for 20 residents each, and when a coworker goes on break, the load goes up to 40 people per aide. Macalino says she's developed depression because of the nonstop pressure of multiple patients needing help all at once.
Even if it's hard for you to do it, you have to do it. You have to do it because no one will look after them. And something happened, you're the one who will be blamed because you're the one who's on the floor.
The aides say they care about the residents and worry for their safety. They say some grow restless as they wait, often screaming, arguing, even falling as they try to get up. Harold Delacruz says his 17 years working there have taken a toll physically and mentally.
There was one time, I said to myself, I just want to give up. I felt like they're trying to break us.
In an email, Holy Family said it appreciates its healthcare aides' dedication and said employees with concerns should approach management or their union. But the aides say they're afraid to go to their bosses after being issued official complaints for incidents they say were out of their control. So they went to an advocate for help.
What got my attention is that intimidation. They don't want to talk. They don't want to lose their job.
Etta Pangilinan says she took the aides to meet with their union. CUPE confirms meeting with them and says it's filed 2 grievances on their behalf.
In a statement, the union says it wants the health minister to reintroduce a bill calling for mandatory minimum staffing levels. The province says it's steadily increasing the required hours of direct care per patient and hopes to meet the national standards of 4.1 hours a day soon.
Holy Family says the long-term care home consistently exceeds this ratio, providing each resident with about 4.2 hours per day. But a national seniors advocate says that formula doesn't account for patients' individual needs or when that care is provided. Laura Tamblin-Watt says that can leave night and weekend crews short-handed. She says implementing a staff-to-resident ratio instead could help alleviate workload.
If they don't have any help and they feel like they're being attacked or traumatized by people who are frustrated with the reduced level of care they can provide, they're going to go somewhere else. They're going to go find another career outside of the seniors care sector.
Pangilinan says she plans to ask the Premier and Health Minister to step in.
Treat them as human beings, not slaves, and listen to them.
Emily Brass, CBC News, Winnipeg.